Hi, good morning. This is Dr. Handrada. I'm here with Dr. Alex Manjarian. This is our fourth video. Uh, and thank you for watching the video. Today, we are going to talk about another important area of the brain, which is called the insula. And the last time we talked about the cingulate cortex, and we also talked about how under stressful situation, the top-down control is lost, especially the control from the prefrontal cortex on the amygdala, which in turn is responsible for the stress response. Today, we are going to expand on that particular topic. But before we start with the function of insula, uh, in terms of interoception and exteroception, we're going to talk about these terminology. I want to reintroduce to three different areas of the brain. So the first MRI images that you see from left to right, you see the axial section, the sagittal section, and the coronal section. And the area that is marked in red out here is the dorsolateral prefrontal cortex, which is usually responsible for the top-down control of attention, emotion, as well as behavior. The main function of the dorsolateral prefrontal cortex, as we all know, is working memory. Apart from working memory, it's also responsible for abstract thinking, set shifting, task setting, as well as it's also responsible for motor planning and decision making. So it has a lot of function, right? So now you guys know where the dorsolateral prefrontal cortex is, because when we start talking about its role in the top-down control or cognitive reappraisal, I don't have to come back to the MRI image because you're already well versed with its location. Now let's shift gears. I want to introduce you to or reintroduce you to another area of the brain. You already heard about this structure in our previous videos. So this is again MRI images, three scans from left to right. We see the axial section, the sagittal section, as well as the coronal view. Now, the one that is shown in green is the amygdala. Just follow the cursor. The green one is the amygdala, which is located in the anterior medial part of the temporal lobe. And as we all know, the function of the amygdala is to detect a threat, and it's usually responsible for assigning a valence. That means that it's going to actually say whether a particular stimulus is important, is bad or good. Okay, that is what valence means. Okay, so I'm going to just write it here, VALENCE. So this basically says if a particular stimulus is bad or good. Plus, it also helps to give a salience to a particular stimulus. Salience basically means that do you need to pay attention to this particular stimulus? That means that does it have a behavioral significance? The reason I'm actually talking about this particular terminology is that we are going to use it moving forward. So I want the listeners to know when I talk about valence and the salience, right? So there are two different concepts that plays an important role on how the amygdala is going to respond to a particular situation or a stimulus based on the context. Pause. Pause. Now we are looking at another MRI image. Again, as I mentioned previously, we are moving from left to right. So the sections that you are seeing is an axial section, A, B is the coronal view, and C is the sagittal view. And the area that is marked in red, it's known as insula. And this is what the insula looks like. A, the B, the insula is right here. And the sulcus that you see right here, where the pointer is, That's the sylvian fissure, right? So the insula is tucked right inside the sylvian fissure. This is the frontal operculum, and this is the temporal lobe. So when you separate them, what you see right inside is the insular cortex. Sometimes it is also called as the fifth lobe, right? This is the MRI image C. The red one is the insular cortex, right? This plays a very important role, especially in the perception of interoceptive and exteroceptive signals. We're going to talk about these signals. Let's introduce the concept. So when I say interoceptive signal, I mean to say signals that originate inside the body, right? This could be visceral response to a particular situation. So this could be your heart rate, right? This could be your respiratory rate, the breathing, right? This could be temperature. Thermal signal. This could be hunger. This could be thirst, etc. Right? So these are signals that originate inside the body. Then you have other type of signal which is called as the exteroceptive signal. These are signals originating outside the body, right? So exteroceptive input or signal is a visual signal, right? What you see, the auditory, what you hear, right? The olfactory, what you smell, right? Vibration, right? As well as proprioceptive signals, right? Or the vestibular signals. So these are all external signals, right? So you have interoceptive signals, you have exteroceptive signals. Then we are also going to talk about something called as context. Context basically means the context in which these signals were elicited, right? So the context can be you are in a party, right? The context could be you are watching fireworks. The context could be you are in a combat zone, right? So these are contexts which causes the interoceptive signals, right? So that is what context exactly means. So I just wanted to explain the terminology before we start talking about the function of the insular cortex and how it coordinates with the prefrontal cortex as well as the amygdala to generate a physiological and a behavioral response to a particular situation. Now, since we know where the dorsolateral prefrontal cortex is located and what its function is, we also know where amygdala is located and what its function is, and we know where the insular cortex is located. And now we are going to talk about what is the function of the insula, because you will hear this terminology in almost every psychiatric illness, right? So thousands of fMRI scans that has been done, what the research data shows is that the two area of the brain that always gets involved is your dorsal anterior cingulate cortex as well as your insular cortex. This is involved in almost every psychiatric illness, and together they form what we call as the salience network. Salience network is going to pick something that is salient, which has a behavioral significance, right? Or an emotional significance, as well as threat information. So now let's talk about the insular cortex. The insular cortex is basically divided into three different parts. So suppose that this is the insular cortex. It's divided into the posterior insular cortex. It has a middle insular cortex, and it has an anterior insular cortex. These are the three areas of the insular cortex. Let's talk about what exactly they do. So interoceptive signals, we talked about signals that originate inside the body. These signals are first integrated in an area in the brainstem, which is called as nucleus tractus solitarius. Okay, so I'll just write this down. It's nucleus tractus solitarius. This is an area that is present in the medulla, in the brainstem, and this is usually responsible for receiving information through cranial nerves 7, 9, and 10. 7 is facial nerve, 9 is glossopharyngeal nerve, 10 is a vagus nerve. Cranial nerve 7 is responsible for gustatory information, right? Or signal, that is taste. Cranial nerve 9, that is the glossopharyngeal nerve, also plays role in gustatory signal, but it also is responsible for cardiovascular and respiratory function because it carries signal from the carotid body to the nucleus tractus solitarius. And as we know, the carotid body plays an important role, especially in determining the partial pressure of oxygen, as well as it also has baroreceptors, right? So the pressure inside the blood vessel. Cranial nerve 10 is the vagus nerve, which also plays an important role in GI function. So it usually carries the GI signals. It also carries signals from the aortic body, right? Which also plays an important role in the cardiovascular and respiratory function, as we mentioned with the carotid body. So from the carotid body, the information is carried by cranial nerve 9, that is glossopharyngeal, and from the aortic body, the information is carried by cranial nerve 10, that is vagus nerve, to the nucleus tractus solitarius. So this is the place where you're going to perceive the taste sensation, the GI signals, as well as the cardiovascular and respiratory signals. Then what happens is that this sends this information to an area of the brain called parabranchial nucleus, again present in the pons, plays a very important role. And the parabranchial nucleus, apart from getting all this information from the nucleus tractus solitarius, also gets information from a spinal cord, especially the thermal, as well as the pain sensation through the spinothalamic tract. This parabranchial nucleus then sends the information to the thalamus. And as we all know, thalamus plays an important role in arousal, as well as it's a sensory relay station. Almost all the sensory information will flow through the thalamus except the olfactory information. And the anterior thalamic radiation will then send the information to the area of the brain that we are going to talk about. So the thalamus will send or forward this information to the posterior insular cortex. That is this, right? So the posterior insular cortex is also called as the primary interoceptive cortex. So the function of the primary cortex is perception. So it's going to perceive the interoceptive signals both the intensity of the signal as well as the location. That's it. Its function is perception. It will then transmit this particular information forward to the middle insular cortex. This is an integration center where it will integrate this interoceptive signals all right? And it is going to focus on the interoceptive accuracy, that is the number of heartbeats, for example, plus the emotional state that an individual is. That's its function. What that does is that from here, the information is going to travel to your anterior insular cortex. This is a very important area of the insular cortex because this is the place where the interoceptive signal is integrated with exteroceptive signals, along with the information that is sent from the amygdala. We're going to talk about this. We're going to simplify this with real life example. And then it's going to actually integrate the interoceptive and exteroceptive signals with an emotional variance, that is, whether it's good or bad, the signal or the interoceptive signal especially, as well as with the emotional salience, whether it needs to pay attention to it or not, right? So the anterior insular cortex is going to integrate the interoceptive signal, exteroceptive signal with an emotional variance, or as well as the emotional salience. So now we know the function of the anterior insular cortex, which is another integration center. Now let's see, where does the information travel from here? Again, I'm going to just draw a cartoon of the insular cortex. This is the posterior insular cortex, the middle insular cortex, and the anterior insular cortex. Not to make it too complicated, if you look at the anterior insular cortex, let's divide it into two parts, right? One is the dorsal part, and the other one is the ventral part, right? So we will call this as dorsal anterior insular cortex and the ventral anterior insular cortex. What the ventral anterior insular cortex does is that it has a to and fro connection, like it's reciprocally connected to the amygdala. Whereas the dorsal anterior cingulate cortex is connected to your prefrontal cortex, right? So this will be both the dorsolateral as well as the medial prefrontal cortex, all right? And through connections that we talked about in our previous video, right? In our previous video, we talked about a connection where we drew subgenual anterior cingulate cortex, right, which is present on the medial part of your prefrontal cortex, which is also called as the ventromedial prefrontal cortex. And in the previous video, we learned that this particular area of the brain will stimulate the intercalated cells in the amygdala, which is responsible for inhibiting the amygdala. So this is the top down. So this whole thing is the top down control of the emotions, right? And we know under stressful situation how this top down connection gets disconnected. If you want to know in detail, please go to the previous video, watch the previous video, how the disconnection happens in stress, right? So now let's focus on these areas of the brain. And I'm going to actually start with the example, because examples makes it easier to understand what we are talking about. Let's look at a normal, healthy individual, all right? So you hear a loud bang, right? There's a loud noise. The amygdala will pick the noise. The amygdala is going to actually say, hey, this is concerning, right? We have to pay attention to it. But it doesn't know exactly what is happening, right? Because it doesn't have the context. Amygdala knows how to respond to a threat in the environment. That's its function, right? That's basic function initially. So there is a noise. The amygdala actually says, hey, this is concerning. This could be dangerous or this could not be dangerous, but it doesn't know that. It cannot differentiate it. When this loud bang happens, you have an increase in your heart rate. Your muscles will tense, right? You can even get startled. That information then travels into your posterior insular cortex, right? Now, both the activation of the amygdala as well as the posterior insular cortex happens simultaneously. It's not two separate processes. The interoceptive signals will then travel from the posterior insular cortex to the anterior insular cortex. And the amygdala information travels to the anterior insular cortex, right? So now the amygdala is going to feed two different things into the anterior insular cortex. It's going to actually send the valence. That basically means that whether this is good or bad. So the amygdala has actually detected that this could be bad. It's also going to actually send the salience to the anterior insular cortex that we need to pay attention to this stimulus. The anterior insular cortex is also getting our body's physiological response to this loud noise. That is increasing the heart rate, your muscle tension, as well as the startle. Now, the anterior insular cortex is going to integrate these interoceptive signals and the exteroceptive signals with the valence and salience information from the amygdala. What the anterior insular cortex now is going to do is it's going to say, yes, it's concerning because the heart rate is increased, there's an increase in the muscle tension, and you are startled. But at the same time, the anterior insular cortex also gets contextual information as to like what is the context that this loud bang happened. So suppose that it happened because there was a firework, 4th of July, right? Because it happened, this loud bang was because you are in a very loud party, right? So the anterior insular cortex is going to say, yes, it's concerning because of the body's physiological response, but at the same time, it ties it to the context and says that, hey, this is during a party or a firework. So now we talked about how the integration of information happens in the anterior insular cortex. So anterior insular cortex is going to actually integrate the interoceptive and the exteroceptive signals with the valence and salience from the amygdala. Plus, it's also going to give you the context in which the loud bang happened. So it was a firework or it could be a party. And we are talking about healthy control. This particular information will be carried by the dorsal anterior insular cortex to your prefrontal cortex. For the prefrontal cortex now, and at the same time, this information is also carried into your amygdala, right? So the anterior insular cortex basically is telling the amygdala through the ventral anterior insular cortex that yes, the loud noise does need attention, but it is not dangerous as it happened in a very controlled setting of a firework or party. I don't know how controlled the party is, but let's assume that it's a controlled party. And the prefrontal cortex also receives the information about the context that this loud noise occurred. So what the prefrontal cortex now does is it's going to send information to the intercalated cells, which in turn actually modulates the functioning of the amygdala, preventing the fight or the flight response, right? So instead of escaping and avoiding, you are going to enjoy the party or the firework. Now, let's switch the scenario. Let's consider a patient with PTSD, right? This is not a video about PTSD. I'm giving this particular example for our audience to understand what exactly happens when there is a pathology. So in patients with PTSD, let's take a similar situation, right? A person is in a combat zone, they come back, and they've been diagnosed with post-traumatic stress disorder. When we talk about PTSD, we'll talk about how the top-down control over the emotion is lost. So what happens in PTSD is that there is a decrease in the activation of your ventromedial prefrontal cortex. I'm not going to go into how that happens because we're going to talk about it. So at this time, I just want the audience to remember that there is a decreased activation of the ventromedial prefrontal cortex in patients with PTSD. So there is a loss of the top-down control, right? That basically means that there is no cognitive reappraisal happening. All right. Now, the amygdala has no modulation from the top. All right. Let's look at the situation again. Loud noise. The amygdala gets stimulated and it says, this is concerning, or this could be a threat. It will send the valence, which is whether this is good or bad. So it's saying that this is bad, as well as a salience, which says that this is important. We need to pay attention to this. At the same time, when there's a loud noise, the heart rate goes up, there is muscle tension, person is startled. That information flows into your posterior insular cortex. From here, the information flows into your anterior insular cortex, where you integrate the interoceptive and the exteroceptive signals, along with the valence that this is concerning, it's bad, and the salience that we need to pay attention. At the same time, the anterior insular cortex also gets the contextual information that this is either a firework or there's a party going on next door or in your neighborhood. Anterior insular cortex recognizes that the loud noise is concerning, but then it looks at the context is not concerning. So the brain should actually respond by saying that you are in a very safe situation. You're not in a combat zone, so you don't have to escape or avoid or go into a fight or a flight mode. But in patients with PTSD, the top-down control is lost. Or patients with depression, right? We know that under stressful situation in the previous video that the top-down control is lost because the intercalated cells, instead of inhibiting or modulating the activity of the amygdala, this top-down control is lost. So what happens? Now the information goes into the amygdala and there is no cognitive reprisal, and this actually leads to the fight or the flight response. Right? So the basic function of the insular cortex is to give a salience as well as control the intensity of an interoceptive and exteroceptive signal. This is a very important part of the salience network. So when there is excessive activation of the insular cortex, it can lead to hyper-emotionality. That means that there will be an increase in the intensity and the salience of the threatening information. And when there is hypoactivation of the insular cortex, then you cannot actually determine the intensity and the salience of the interoceptive or the exteroceptive signals. And that can lead to something called emotional numbness. When we talk about somatic symptom disorder or patients with functional neurological disorder, we'll talk about other functions of the insular cortex, especially like how they perceive pain, why distraction helps to decrease pain, right? When you're working out in the gym, we always say no pain, no gain. How does that happen? How is people actually able to push through the pain in the gym and are not that distressed? So we are going to talk about all these things when we talk about somatic symptom disorder or functional neurological disorder. But for now, I just want people to get a basic idea of what is the function of the insular cortex. So it basically determines the salience and the intensity of an interoceptive or exteroceptive signals. So today, let me summarize what we talked about. Let's look at the top panel. It's less crowded. So we talked about the insular cortex. This whole thing is the insular cortex right here. We have divided into posterior insular cortex, middle insular cortex, anterior insular cortex. The posterior insular cortex is going to receive the interoceptive signals. It's called as the primary interoceptive cortex. So it perceives all these signals. It will forward these signal to the anterior insular cortex, which also receives information from the amygdala regarding which is going to attribute a salience and a valence to the stimulus. The anterior insular cortex is going to integrate the interoceptive signal and the exteroceptive signal, and with the valence and the salience information or the limbic or the emotional information that's getting from the amygdala. So the anterior insular cortex is responsible for the subjective experience of the emotions. So it's going to get the emotion to your conscious awareness. The anterior insular cortex then sends the information to the prefrontal cortex, which is responsible for the top-down emotional control or cognitive reappraisal, telling your brain whether it is safe or there is a threat. And based on that, the amygdala is going to respond. If the prefrontal cortex has no control over the amygdala, then everything in the environment becomes a threat. Now, the amygdala, without the prefrontal cortex, is not able to determine or distinguish between safety and threat, which leads to generalized anxiety. Everything becomes a threat. So this is what we talked about today, and I hope it makes sense. And thank you for listening. The next episode or the next video, we are going to tie some of these areas of the brain together and talk about the neurobiology of depression. Thank you.